Entonces no sé por qué ahora está pidiendo registro, pero bueno,
No sé, porque a
very
veces,
strange.
sí, a veces hace esas cosas como que cambian los códigos esos de seguridad. ¿Le puedes explicar a Pranav qué va a hacer con el canal este cuando lo ponga?
Okay. Hi
Gracias.
Pranab,
Ah,
and Sohom, and everyone else who's an English speaker. Um,
No, solo a él.
I am going to be your interpreter this evening. I will be interpreting into Spanish, so speak at your leisure. No problem. At the bottom of your screen, when the interpretation is turned on, you're going to find a strip, and it's going to say English Spanish. So please choose English, and if you need to, mute the original audio just in case. And if you need anything, just let me know. I'll be, listening to you and letting you and helping you out with whatever you might need.
yes.
Voy a conectarlo, ¿es?
Okay.
Pero si estás como intérprete.
Oh, no.
No, me refería a que sí entraste de una vez como intérprete.
Sí.
Buenas noches, Ana Miriam. Hello, Rona.
Hola, buenas noches.
Buenas noches, Ana.
Buenas noches.
Buenas noches, Constanza.
¿Cómo están?
Bien, gracias. Aquí ya, imagínense que allá ya son las 6:30 en la India.
Wow.
Buenas
Pensé que ibas a
noches a
tener tu
ustedes
pelo
también.
pintado.
Buenas noches. ¿Quién habló? ¿Quién habló?
Luis Fernando Segura, buenas noches, me alegro de saludarlas.
¿Cómo está Luis Fernando?
Buenas
Buenas noches.
noches.
Bien, muchas gracias. Una pregunta, ¿va a ser en español o debo poner el traductor?
Sí, tienes que poner el traductor, ya está.
Ah, bien, bien,
Ya está
gracias,
listo.
te agradezco, muy amable a la espera.
Igualmente, Luis.
Muchas gracias por la invitación, estoy muy emocionado, gracias.
Vamos a sacarle el jugo para nada, aunque él no lo sepa.
Sí, está bien, hagámoslo. Gracias.
Cuídate. Vamos a esperar unos 3 minutos para ser muy corteses con Pranav, que está puntual. Y para quienes ya están con nosotros, por supuesto. We're waiting just a few minutes, Pranav.
Okay.
Just a few minutes.
Okay. Sí.
Yeah, and your grandson is a co-host with me, so he's going to make this to share, right?
Yeah.
Okay, 2 minutes.
¿Perdón? No, las tienes tú. Pensé que ibas a tener el pelo pintado.
No, era una peluca.
Me encantó.
Era una peluca. Estaba jugando con las pelucas. Tenemos un programa de donación de pelucas oncológicas y a veces vienen unos colores así bien simpáticos y nos las probamos. Pero ese sí, porque hasta el peinado, porque tengo que agarrar pelo, pero hasta el peinado era idéntico.
Okay, since Juani is ignoring me, can you do me a favor and plug this in? Can you plug this in for me? Thank you.
Tienes en la base, si estás en computadora o en celular.
We're just, some people are asking how to connect onto the interpretation. So Wendy's giving them instructions.
Hay unos puntitos, apachas ahí y te va a salir un listado. Entonces ya dices interpretación.
Ujú.
Ahí en interpretación escoges español.
Y listo.
No, todavía falta algo. Más abajo dice cancelar audio original y tienes que apacharlo porque si no vas a escuchar los dos idiomas al mismo tiempo. Y luego ya le das listo, arriba.
Hola.
¿Sí?
Ahora no le escucho nada.
Porque ahora ya escuchas a la intérprete.
Sí,
Ok,
gracias.
ok.
Ay, Wendy, gracias por tantas capacitaciones.
Créanme que estoy tocando las puertas del mundo entero para ustedes, lo prometo.
Muchísimas gracias porque eso nos ayuda muchísimo.
Sí, y prometo que a
They're
quienes yo...
thanking Wendy for all the training, and she's quite happy that we have different cultures, different origins.
Te queremos y respetamos mucho.
Gracias, de veras lo recibo con mucho cariño porque sí, yo soy cero egoísmo, así es que donde ustedes me miren, si ahí están ustedes también.
Te seguimos.
Gracias.
Gracias, güey.
Saludos siempre.
Pranav, we're ready, so I'm going to introduce you in Spanish. And then you can start talking in English. The interpreter is, it's going to be,
Okay.
you don't have to, just a little slow, please, but it's perfect. Okay. Bueno, vamos a grabar antes.
Okay, so we're going to start recording for those who aren't able to join us tonight.
Recording in progress.
Buenas noches, muchísimas gracias por estar con
Good
nosotros.
evening. Thank you so much for joining us. It's truly a blessing to be in your homes through this wonderful tool. I would like to introduce Dr. Pranav Barsu. He is in India. They're 12.5 hours ahead of us. So he already went out for a walk. He wrote to me and he said that he had a good walk to meditate, to be able to give this talk or this master class that we're going to be receiving. So let us learn a lot from him. He is a very humane person, and his teachings sent him toward the world of compassion. So welcome.
Thank you, Pranav.
So thank you, Pranab. So we're ready and open and willing to listen.
Good morning to all. I am Pranab Basu from India. Actually, now, thanks to Wendy Pineda and Elizabeth Kubler-Ross Foundation, Guatemala, for giving me the opportunity to take a class. And there is a bonding is formed, and I am happy to become a connecting bridge between Guatemala and India, and it will continue. I hope so, and I am privileged to be associated with Elizabeth Kubler Foundation for the last 1.5 years. So actually, after the demise, I was an assistant headmaster in teaching line, but after retirement, when my wife was suffering from metastatic colon cancer, so she suffered for 2.5 years, and I was a sole caregiver, and I learned a lot while caregiving her. So that's why I just learned many things on palliative care. Online classes were formed and I attended. So this time, Wendy Pineda from Guatemala, Elizabeth Kubler Foundation invited me to take a class on palliative care, and I am happy. And this is my introduction. I am now 75.
Please continue, Pranab.
Buenas noches.
Good evening. Pranab, can you hear me? Pranab? Hello, hello. Can you hear me, sir? Yes, sir, please do. Can you hear me?
Do you need something?
Today start.
Okay.
Pranab, can you hear me? Hello, hello.
No, nothing.
Okay. Are you okay?
Okay.
I love you. We love you all. So we're waiting for your grandson, right?
Yes.
Okay. You must come to Guatemala.
Yeah, if I get a chance, I will definitely. Actually, I am so connected with you all. So I love to meet personally, in person. But that is not possible always.
Pranav, I think you can start now.
Oh, okay. Palliative care is the word palliative originates from the French word palliative, and afterwards palliate comes from the word pallium, the Latin word meaning to cloak or to cover. To palliate means to alleviate what? The pain, the total pain of a patient who is terminally ill and suffering from physical, mental, social, financial, and spiritual pain. So, palliative care is a holistic and humanitarian approach, mitigating suffering, consequently the quality of life of patients and family members being improved, provides comfort and facilitates the end of life journey with peace and dignity. So this is a summarized definition. The palliative care definition has been formed by WHO, World Health Organization, and recently International Association of Hospital and Palliative Care developed a consensus-based definition of palliative care. So mitigates sufferings and provides comfort to the patient and family members as well. This is a holistic approach. The total pain, physical, emotional, social, and financial and spiritual, are alleviated to provide comfort to the patient and uphold dignity. It is a patient-centric. That means as a whole, the person is concerned. Treat the person as a whole with the aid, empathy, compassion, and love. Love is the most important aid to me, I feel. And here is a feeling will be aroused. One must have a compassionate heart in this service of mankind. If you don't have the compassionate heart, you can't serve, you can't take care of the patient to provide him or her the comfort. Better to begin at diagnosis. Normally, when doctors raise their hand, finishing their chemotherapy, radiotherapy for cancer patients, then they send to the palliative care normally. But I feel that this palliative care approach treatment should start at the very beginning of the diagnosis. Then only the patient will get comfort. Symptom relief, the pain management will also be covered. Not only the patient, but we also look after the family members, the caregivers, to boost their mind, mental state, and so they will think in a positive way. No negative thought will be entertained. End of life care is a very important aspect of palliative care. Normally, at the end, persons feel loneliness, persons feel isolated. So the aging elements are there. So we must take care, we must get connected, we must take time to give time to the persons sitting beside him, chatting, gossiping for some time. This is the connection. There is a saying that I have so many contacts. It is my vanity. I have very much contacts. But if I ask him that you have many contacts, but do you have time to give to your elderly parents at the end of life? How much time you give? No, I don't have time. Then what is the value of contact? No value. The value is lies in the connection, the word connection. So connecting with the patient, connecting with the elderly is the main aspect of palliative care, so far I think. Next. This is the domain of palliative care. Palliative, there is a diagram. The diagram symbolizes total pain, physical, emotional, social and financial and spiritual. Palliative care ensures mitigate total pain, asserts life and considers dying as normal process. This we cannot accept. If we can accept that dying is a normal process, we will get peace, we will get comfort. Intends rather to hasten nor postpone death, enhance quality of life. The palliative care enhances quality of life, better quality of life, not the longevity, but the quality of life. We stress, we emphasize on the quality of life. That means the life we are living must be in a good manner, peacefully, with dignity. We are born and we have to die one day. In between the journey, there are so many hurdles, so many challenges we face. So we must face the challenges, we must cross the hurdles, we must overcome the problems only with the positive thought and with the help of this palliative care. Next. There is no end to cure, but there is end to cure, but there is no end to care. Care, to me, it is my analysis. C for compassion, A for alleviation, R for recovery, E for empathy. So compassion and empathy lead to alleviation and recovery of the terminally ill patients. And palliative care does not end to the death of a person, but it continues in the form of grief and bereavement care for the person who lost the loved one. So we also look after the bereaved families, also counseling, and this is the continuation of palliative care. So there is no end to care. Next. I have just mentioned a few very important quotes. Dr. Elizabeth Kubler-Ross told, the most beautiful people we have known are those who have known defeat, known suffering, known struggle, known loss, and have found their way out of the depth. Another one, the ultimate lesson all of us have to learn is unconditional love, which includes not only others but ourselves as well. This unconditional love is a very important aid. So far, I have found while caregiving, while caring to my wife at the last moment, and I realized what is love. I felt what is love, and she also felt what is love, and eternal love and unconditional love. There is no conditional word. Dr. Abhijit Dam says, life is beautiful, but so can death be. Very good quote. So, I always say to the persons comment that enjoy the beauty of life. Yes, life is a beauty. And so death can be. Death also, we must embrace the death. We must embrace death, not fear. When we fear the death, it will be many deaths, but we have one death once, not many. You matter because you are you, and you matter to the end of your life. We will do all we can, not only to help you die peacefully, but also to live until you die. Dame Cicely Saunders. And Rabindranath Tagore's last quote, because he experienced many grief within 7 years. He has lost his 7 loved ones. Even he was a novelist. Death itself became a love companion, no longer the king of terrors, but altogether transformed into cherished friend. Next. Palliative care is an interdisciplinary team. Physician, nurse, social worker, social medical worker, volunteer, counselor, psychologist, physiotherapist, all work together. It is interlinked, and there is a connection, interconnection, so that the total comfort will be provided to the patient. Next. Persons coming under palliative care: cancer, cardiac disease such as congestive heart failure, chronic obstructive pulmonary disease, COPD, kidney failure, Alzheimer's, Parkinson, amyotrophic lateral sclerosis, ALS, disability, HIV, AIDS, elderly people with aging ailments. There is an important role of a counselor in palliative care approach. Role of counselor is to boost the mental power of the patient and the family members, caregivers. So, there are some steps I have displayed here. Preliminary knowledge of different types of cancer and satisfy and query from the oncologist. I have mentioned cancer here because I have been experienced in caring my wife with cancer. Next, gain confidence of the patient. A very important thing. Patient should have confidence, should have trust on you while counseling. While in the active listening, you must be listening attentively so that the patient would feel that yes, he is giving importance to him or her and listening to his or her challenges, problems in a very perfect manner. So then he or she will pour out the problems being faced by him or her. Monitoring symptoms of anxiety, worry and depression. The anxiety, worry and depression, uncertainty are all the aspects suffered by the patient and the family members, especially patient, while in a terminal illness. Boosting mental power with empathy, compassion and love. Cognitive behavioral therapy, reframing negative thoughts in positive ways, so that the patient should think always in a positive manner, so that he will have a positive result he will be diverted from the fear, from the anxiety, from the worry, from the uncertainty, all these things. He will have power, mental power, which we have within. Every human being having the mental power within their heart. Only it is to activate the mental power in a positive way. Follow non-judgmental questions. That means no, the open question, no closed question. Open question you must ask in a way which will not hurt the patient, and the patient will be imbued, will be inspired to pour out their problems, their challenges, their present or future problems. Sometimes we have to wait with patience. Patience is required for a counselor, because few patients are there who are introverts. They don't want to speak out. So we have to be in a quiet manner, sitting beside her or him, just waiting to have trust from him or her, and he or she will feel that, okay, let me speak out. I can say to him or her. Immediacy, the immediate effect of the feelings aroused, advising to take nutritious food, and reflecting and paraphrasing. So, while counseling the patient, while chatting, while communication is a powerful aid. Good communication will lead to you be in their shoes of the patient. Otherwise, there will be difference, no relationship will be grown. So relationship to that feelings, I must have feelings what he is telling. So listen attentively what he is telling, and afterwards paraphrasing that, you just accept, you just admit that, okay, I feel so. What you are feeling, it is right. I also feel so. So now, in this way, the patient will realize that he is my nearest, closest friend. So we can have a communication chat clearly, openly, opening from the heart. There is within each one of us a potential for goodness beyond our imagining, forgiven which seeks no reward, for listening without judgment, for loving unconditionally. Dr. Elizabeth Kubler-Ross. Caregiving is a great support. Normally, he who cares the patient is unidentified, unrecognized. Sometimes society says that, yeah, that the woman or lady, wife must take care, so must care the patient. It is her duty. But to me, this caregiving, role of caregiving is an art, invisible art, which must be recognized, which must be identified, and it comes from the inner heart, that inner feelings. Otherwise, you cannot do the perfect caregiving. This is my own experience while caring my wife for 2.5 years till her death. Not death, she is now in Galaxy, and I hope she is also inspiring me, and she is also listening to this class. I'm confident. Compassionate caring to the loved one with terminal illness, primary caregiver, secondary caregiver, distant caregiver. There are 3 types of caregiver. Understanding the symptoms, treatment, protocol, side effects of medicine, good communication with the physician, following advice strictly. Respite care. There must be for the caregiver a short-term break for caregivers. Heal thyself to perform the task of caring. This is not always possible, but this is essential for a caregiver, primary caregiver, to have a stable health, to have a perfect caring role, caregiving role. Otherwise, this respite care in the family, sometimes it is not possible, but it must be. Balanced, nutritious diet, regular exercise, honoring emotional needs, restful sleep, boosting resiliency, listening to music. Sometimes caregiver is so exhausted, compassionate fatigue and burnout are the 2 elements, 2 aspects that suffered by the caregiver. So at that time, he or she must be in a relaxing mood for a few minutes, not on longer period, but a few minutes. If he or she listen to music, honor emotional needs, what he needs, have a chat with his or her friends, 3-4 minutes, 5 minutes. When the patient is taking rest, I must take rest. This is the way, the respite care we must have while caring the patient. And without caregiver, the patient will not have comfort, will not have peace, will not have dignity, and we must pay respect to the patient. This is very, very essential aid. So we must pay respect to the patient. Sometimes we cannot, but we must. This is the main theme of palliative care. Next. There are 3 images, diagrams I have given. The first one, you can see that I am with my wife, touching her hand and embracing her while she was undergoing chemotherapy. And this, I feel that this is the unconditional love, and I believe she has gone to the unknown world to me, her home, peacefully with dignity. The next diagram, next image, you see the caring a terminal patient surrounded by nearest and dearest ones. At the end of life, at the end, we want that we will be at home surrounded by my nearest and dearest dear ones, and I will depart to the other world. So this is the need of a dying patient. Sometimes this need to be fulfilled as per the condition of the patient, and this is the condition that they are caring, and the patient is taking rest, and I hope her face symbolizes that she is having a peaceful manner. The third, almost my sister, she is septuagenarian and she is suffering from cancer. She has been, still she is fighting a lot. Her daughter and her grandson, we can see that they are caring, and she is smiling. The patient is smiling, having her daughter and grandson with her, and she told me to take a photo, and I just clicked, and I think this is the main caregiving role, to have a smile from the patient, which is a gift to us, the healthcare providers, to the palliative care healthcare providers. The smile is a gift to be received by us. Next. This is the end of life care, also comes to the palliative care. Is a terminally ill patient being summoned by the last voyage. Focus on symptom control, providing comfort, and dignified, peaceful dying. He needs care in 4 areas: physical comfort, mental and emotional need, and spiritual need. Physical discomfort, mental and emotional distress, spiritual needs and care. This physical discomfort, we know that fatigue, apathy, that is appetite, loss of appetite. The last stage, we see that loss of appetite is there, and this physical discomfort will be supported by the medicine, by the pain symptoms will the doctors, oncologists, the physicians will provide medicines for symptoms control, pain control, and sometimes skin irritation is there, sometimes itching, digestive problem is there, temperate sensitivity. Sometimes the patient feels very cool, very cool, feeling cool, sometimes feeling hot. So this sensitivity varies at the last moment. Mental, emotional distress, what are these? Feeling depressed, anxious, future concern. What is a concern? That those are what will my children do after my going, after my departure? This concern, this is the anxiety, this is the uncertainty, this is the worry the patient suffers from. So we have to provide, we have to speak in a way that he should give comfort. The spiritual needs and care, very important. At the end, I felt regarding in respect of my wife's last journey that she needed spiritual care, and she had within her heart, and she used to chat the mantra, he used to chant the Varshiva's mantra and with the goddess, and she was relieved from pain. I observed keenly, and now during my this work as a volunteer in palliative care, counseling the cancer patients, counseling the elderly care, counseling the bereaved family members. So now I feel that spiritual needs and care is a very important aspect of palliative care. Spiritual means meaning one's life. What is the meaning of who I am? Who I am? What for I am here? What am I doing? What is to be done? These are the questions giving me the life, meaning of life. What is life? So spiritual divides the meaning of the life. It is the inward journey. The journey is inward, not outward. No expression, no offshore, no show off. Just feel inside, feel inward. It is unique to each individual. It is not same. Individual to individual, it varies the emotional, spiritual needs. So we must observe the need. We must take care of the need and then know yourself. Who are you? Who I am? I must know myself. You must know yourself. Love is the prime need. Need for a source of peace. What is the source of peace? What is the source of peace? There is a need. There is a need of the source of peace. Family and friends can talk to the dying person about the importance of their relationship, sharing memories in a good time or emotion, another way. Some people find peace. Sometimes I just had a chat with my wife, the old good memories of our conjugal life. No, the bitter experience, but good experience. So during this conversation, I felt that she was relieving, she was not having pain. She was just in a smiling, in a peaceful manner. She also admitted, yeah, we were there. We were in Ladakh. We were in Ladakh, and in the evening we both were observing the full moon sky, snow-covered Ladakh, Himalayas. So this type of incidents, this type of good memories will comfort, will give the spiritual needs. This is also a spiritual relationship, this connection. So we must take care, we must take conscious, we must be aware of how to deal with the patient, because this is not a hired one. This can be done with the primary caregiver love, unpaid. This can be done only by him or her, like me, but not by the paid caregiver from the hospitals, from the nursing home. this is not possible. This possible is only with the primary caregiver. Always be with the dying person who will get comfort and peace. A dying person needs support. What type of support? He needs support. He needs that somebody is there beside him or her. He or she will not feel isolated. She will not feel loneliness, because loneliness is a curse to me. Loneliness is a curse, and this curse should be kept aside. It should be a boon if I be by her or him. Get some time to just silence present. Sometimes I have seen that silent presence, no conversation, just touching, just pondering, just touch is a very therapeutic effect. Touch has a very therapeutic effect, and just touch, just have presence, silent presence will provide comfort to the patient. This is very important factor for important aid, for important ammunition for providing comfort to the patient and peace, not only comfort, but peace to the patient. Next. Home care visit is a very important factor for palliative care. Without home care visit, palliative care is incomplete. Full circle is not formed. Because I have my experience of home care visit for the patients, for the elderly who are not mobile, who are immobile, who are not able to come to the clinic or to the hospital or to the chamber of the doctor or to the hospice. So we visit to their home, have a conversation, have a chat, and this with the support of the doctor, advice of the doctor, we provide the first image. I am chatting with a terminal cancer patient at his home, and you can't believe what a reflection he has given to me. He was very much worried, he was very much anxious, but when I visited, when I communicated with the conversation, had a conversation, he was so pleased, and his smile I have observed, and that is the satisfaction. This feeling of satisfaction is the main thing for a palliative care healthcare providers. This feeling of satisfaction, this happiness. But I must not be feeling vanity. I must give this happiness to the Almighty. If I can give this happiness to the Almighty, the God, it will be more perfect, it will be more happy. This cannot be who I am. I must hand over this happiness, this satisfaction to Almighty, to God. Next image, there is a rural community courses, hospice. I think first in India, the rural hospice founded by Dr. Abhijit Dam. He is a medical director. He is caring, he is advising, he is touching the patient at the last moment, the cancer patient at home. And he spontaneously does this without taking any remuneration. This is fantastic, this is amazing. I have so much respect to Dr. Abhijit Dam. Hats off. And these two images, I was just visiting home, a rural tribal community in Jharkhand, India, and I felt that if I hold hands, if I communicate in a very good manner, they will feel comfort and peace. And the smile will come out. And this smile is my presentation, my gift, which I will keep. And this will inspire me at this age to run to the Jharkhand tribal community, walk 5 to 6 kilometers across the rural sector, study fields, and have this conversation, communication, and get the gift that is mine of the patient. And when they tell that, please come, elder brother, younger brother, please come again, I tell, yes, I will come again. Next. Death is not an end. Yes, death is not an end. We must accept death as we are born. We celebrate the birthday. We must embrace death so that we can go in a peaceful way. And it is death escapes body, not a spirit. Death is a condition, only changes form, transforms from one frequency to another frequency. Peace and comfort felt by a dying person surrounded by nearest and dearest ones. This diagram has been drawn by Anurag Poddar. He is like one of my grandsons, and I told him to draw this, a dying patient, just few days left, and surrounded by nearest and dearest ones. She is feeling peace before dying, and this is the instance in case of my wife. So it flashed my mind that a dying person should have heart or his nearest and dearest ones to be surrounded by her deathbed. Next. Palliative care continues in the arena of grief and bereavement care. One who has lost his or her loved one. It's a normal loss of loved one. So grief is normal. But grief heals pain. Grief, an expression of love. Death of a loved one brings emotional and spiritual attachment to the loved one. Where there is deep grief, there is eternal love. I feel so. I myself feel so. And Dr. Elizabeth Kubler-Ross said, we have survived loss. We are allowing the power of grief and grieving to help us to heal and to live with the one we lost. That is the gift of grief. Yes, I feel so. After the departure, after I have sent her off to her own home, I have been involved in this work in the field of palliative care. And now I realize that she is not before me in person, but she is there and will be there, always beside me, with me, within my heart. This is the gift of grief. Rabindranath Tagore, you know, he has experienced 6 loved one, 6 persons from 1875 to 1907. And even then, losing his wife, losing his son, and even then he has felt what is grief, what is the gift of the grief, what is the blessings of the grief, and that's why he has poured out, he has jotted down many poems, many quotes regarding this grief and bereavement. One, I am mentioning, death belongs to life as birth does. The work is in the raising of the foot as in the laying of it down. Beautiful, beautiful quote of Rabindranath Tagore. Rabindranath wrote to his friend C.F. Andrews. He wrote in a letter, death itself became a loved companion, no longer the king of terrors, but altogether transformed into childhood friends. So, palliative care does not end to the death of a person, but it continues, the care continues in the form of grief and bereavement care. So, herein lies the importance of palliative care, the holistic and humanitarian aspect. Even during the humanitarian crisis recently, the COVID-19, and during the war, during the earthquake, disaster, we, the palliative care healthcare providers, rushed to the place to serve the needy persons regarding health, regarding comfort, to provide comfort. This palliative care also plays a role in the field of humanitarian crisis, which is a very relevant place, neglected place rather, to many of us. It is a neglected place, and the palliative care team rush to the place and provide comfort and peace to the needy persons. This is all humanitarian, and this is the holistic approach. Thank you very much. Now it is open for you to have a question. If any queries, you are free to.
¿Tiene alguien alguna pregunta que quiera hacer al doctor Pranab?
I don't know if anybody has any questions for Dr. Pranab. A very interesting talk. Thank you very much. It's been very instructive. And my next...
El expositor vivió su experiencia muy cercana a su esposa y a otras personas, pues tiene la capacidad de hacerlo. Mi pregunta es, él mencionaba al final sobre la COVID.
And you were mentioning something about COVID.
Esas personas
and how do you give that palliative care
acá en Guatemala, tú sabes,
to those people who are truly alone and lonely, and that people are saying goodbye or they're close to dying? How do you give them that palliative care? How do you care for them when you cannot be with them? What happens with COVID-19? Because they're isolated in the hospitals, so we cannot really give them these. And for the families and the person who is leaving, did you hear the question, Pranab?
Thank you.
Pranab, did you hear me? Hello, hello.
Wendy, may I?
Did you hear the question, sir?
Yeah, Wendy.
Hello.
May I show? Hello.
Ahí está. Yeah.
Hello.
Yeah,
Hi,
we have a
Pranab.
question.
May I show the book?
Yes, please.
Yeah.
Pranab, we have
tu libro.
Pranab, we have a question for you. I don't know if
Yeah.
you know how to turn on the interpretation.
Yes, please.
Okay, the question is, what happens when we have patients that are COVID-19 positive that are in a hospital where you cannot access them and you cannot give them that palliative care? What do you do? How do you give them that palliative care? I'm going to ask you a favor, Pranab. Wendy is going to turn on the interpretation. And I need you to choose English, okay?
Okay.
Wendy, probamos.
Actually, this is a very tragic scene for the COVID-19 patients dying in hospital and being treated in hospital without any nearest relatives who are there.
Un apoyo sin ninguna persona, y yo creo que nosotros deberíamos de tener
language from the distant. We can provide comfort to the patient if hospital allows. We will be well equipped. We must be well equipped with the PPE, and we will just expression eye contact, through eye contact and through facial expression, through hand raising. We must provide, we must make him known that we are here beside you. This is the way, I think. But this is not done officially. Unofficially it can be done, but officially there is a restriction, there is a prohibition that it cannot be done. But it must be done, and it is the need for the palliative care.
¿Alguien más que tenga alguna pregunta?
Pranab, can you hear me?
Yeah.
Okay.
Yeah. Have you found out the answer? Are you satisfied? Are you satisfied?
Yes, totally satisfied. Thank you very much.
Bueno, si no hay más preguntas, pues muchísimas gracias por habernos
We don't
acompañado.
have further questions. Thank you for accompanying us. I'm going to turn off the channel.
Muchísimas gracias por habernos acompañado. Thank you so much, Pranav, for being with us. Thank you, thank you. Muchísimas
Thank you.
gracias.
It is my privilege, it is my blessing to have been connected with you guys, and really I'm very much happy.
Nietzsche, es una gran bendición haber estado conectado con nosotros y está muy feliz. Y creo que va a ir a desayunar. Are you going to take your breakfast, right?
Yeah. No, that is at 9 o'clock. Not
Okay.
now.
Chulo. Okay, muchísimas gracias a todos por habernos acompañado. Thank you, Pranav. See you soon.
Thank you all the participants and the eminent scholars who have present and who have listened to my conversation, session, and I am grateful, I am indebted to you all. Thank you very much for the presence. Okay.
Thank you. And thank you, Sahom.
Thank you so
You're a
much.
nice guy.
Welcome.
Okay, es el nieto de Pranav que lo estuvo ayudando todo el tiempo, así es que muchísimas gracias a todos por haber estado y nos vemos el marzo 23 con la NIS. Les va a gustar mucho esa clase. Así es que muchísimas gracias. Thank you, Pranav. Buenas noches a todos.
Gracias a ti y a todos. Gracias. Muchas gracias.
Gracias, Luis.
Todas. Siempre tan
Gracias, Wendy. Feliz noche.
Gracias.
Wendy. Feliz noche. Gracias por todo.
Recording stopped.
Recording stop.